Using research from the National Income Dynamics study, the UCT Liberty Institute examined the impact on both jobs and income across the economic spectrum. The group's data shows that middle-class and high-earning South Africans are under financial strain, earning salaries lower than before lockdown. The average salary for those earning over 40,000 rands per month have declined. Even amongst those in low-paying jobs, people earning less than 3,500 rand per month. Average salary figures have dropped compared to pre-COVID levels. South Africa's lockdown came into effect on 27 March 2020 and passed the 500-day mark on 9 August 2021. The national state of disaster has been in effect for 17 months.
To talk to us more about this via Zoom is Dr. James Lappeman, the head of projects at the University of Cape Town's Liberty Institute of Strategic Marketing. James, a very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Hi, Simpiwe. Thank you very much for having me.
What exactly can we attribute this to?
Look, I think, there's I guess where the study started was this kind of big question that we had, which was, yes, we see numbers coming out of the news, 1 million jobs lost, 1.5 million jobs lost. But for many of our stakeholders, the big questions were, where are these jobs being lost? Whether it be for companies, for brands, maybe they're targeting the top end of the market or the middle class or poorer consumers, obviously education. There's lots of questions around where. And so what we did was we looked at the data coming out of the National Income Dynamics Survey and the NIDS CRAM, and we divided it into income segments and then started to analyze and started to have a look. And obviously the data came back really that the impact has been felt across the board. So I think everyone, each segment has been impacted in some way. But the greatest toll, as I think we would come to expect, has been felt by the poor.
Yeah, and these economic impacts, and the jury's still out on whether there will be short or long term, can actually translate into reductions in long-term growth, isn't it? And as the health sector, James, soaks up more resources and as more people reduce social activities, countries invest less in physical infrastructure, and this obviously slumps growth and adversely affects the citizenry, isn't it?
Yes, indeed. Look, I think, South Africa is an incredible country in terms of there are multiple sectors. And I think, sectors like agriculture have actually seen growth. There's been a strong demand for food in many places. But at the same time, exporting has been difficult. Things like, container shortages have impacted prices. So, it's like moving furniture around a house, but all the furniture has got strings connected to each other. And you move one thing and it pulls something else off the wall. And if you look at for example, tourism in South Africa has a greater contribution to GDP than mining. And so we think about mining and we think about that as a big sector in South Africa, but tourism is huge. And without flights coming into the country, restaurants closing, we've heard news of many thousands of restaurants closing. Those are just examples of places where the impact has been felt. And obviously the ripple effect, we don't know where this is going to land. The census has been delayed. And I can't wait, to be able to look at that, to be able to highlight, which areas are going to need the most attention to rebuild.
Yeah, James, unplanned pregnancies rose sharply in South Africa during this pandemic. In fact, the Department of Health reported that about 23,000 girls between the ages of 10 and 19 fell pregnant between April last year and March this year, likely as a result of the prolonged school closures. Well, I'd like to believe, but I stand to be corrected. So adolescent mothers are now less likely to return to school, and their children will likely have fewer health and educational investments. This will be another extra burden on the already distressed low-income families, isn't it?
Absolutely. And I mean, I don't have any, kind of anything to add to that in terms of research from our side. But of course, the lockdown and the abnormalities in many aspects of people's lives, whether it's, wealthy homes all the way through to the poorest home, the abnormalities have been there. And obviously that has had a dramatic impact on the social fabric of South Africa. It's put vulnerable people and people on the margin in even more compromising positions. And, we talk and we've spoken at the Institute in years gone by of the double penalty for being poor, that many poorer households, not only are they poor and they've got low incomes, but also they pay higher prices because of maybe living in the rural areas, and there's many reasons. And I think with COVID, you're seeing those penalties increase, distance from opportunity, a disconnect from the digital infrastructure in the country is taking its toll. And I think, those in vulnerable situations, as you mentioned, vulnerable teenagers and specifically women in South Africa, we know are in that vulnerable category. Clearly being impacted.
And especially families where women were the head, were particularly more vulnerable to the economic or the financial impact of COVID-19. And about, 40% of mothers in South Africa, I do understand, are single parents, and about 60% of children live in families where the father is absent. Did this factor alone drive the lowered standards for livelihoods for South Africans?
I mean, look, I think there's many factors involved, and that would be true. And obviously, South Africa has a legacy going back for many decades of apartheid, spatial planning, migrant labor. Many things have impacted the fabric of the family in South Africa. Where I think you mentioned some stats, and the one that I think is so important, kind of sits in my mind is that only 30% of households in South Africa have children growing up with both biological parents at home. So, often, I work in the marketing community, and often marketers will, present a picture of the average South African family, having mum and dad sitting around the table with the children. But that's not the average. The average is a very different story. And so, it's what you described is absolutely true.
Yeah, and the South African government has received so much accolades in terms of heeding the call from civil society in terms of providing economic and social relief packages. But the question still remains, are those packages enough? And how long can the government continue providing such packages?
Indeed, and look, I think that the kind of the fiscal measures and kind of balancing government income and expenditure, those are very complicated questions. But one thing I will give the government credit for is in times of need, emergency measures do need to be taken, and there's certainly been a big outflow of money into households that are in need. The research has come back to say that as you described, women and especially female-headed households haven't received as many benefits. But I think the idea of crisis, there needs to be crisis management. There needs to be an inflow of money. That has happened. Is it enough? I think we know that, especially in the poorest households in South Africa, it's not enough. Incidences of child malnutrition are still very high. And the reports of households and children in households going without meals is still very high for a country like ours, where we should be able to at least ensure that every child gets fed every day.
Yeah, and just picking up on your last point, how do we ensure that we cushion those vulnerable groups, in particular, against the devastating impact of the pandemic? And I mean, on the ability of the caregivers to provide food and social relief measures for their families?
Yes, absolutely. Look, I mean, there's some wonderful organizations doing a lot of work. I'm very well connected with a number of big companies, especially in the food sector, that are providing a number of meals. And I think especially last year, the school closures had a big impact. There are a lot of school feeding schemes, and the school closures had a big impact on child food security. But we've seen many aspects of the country come together, and yet we're a country with many challenges, and those challenges are going to take efforts greater than we've seen, and obviously pulling together government and civil society and business. Hopefully, more can be done in years to come.
And the caregivers are now suggesting that they need to be supported with the non-cash incentives, such as food vouchers or food parcels. And it begs the question, James, where will the government get the money to provide that in the medium to long term? Because it means that the government needs to start taking some resources from other departments, hence halting the projects of that particular department. In a sense, borrowing Paul to pay Peter.
Yes, I think, again, I don't envy those in government needing to make those decisions, but I think it's going to need application of wisdom, experience, yes. And I do think that a challenge that certainly we've looked at is, when it comes to the middle class, the wealthier segments, they obviously form the majority of the tax base in South Africa, personal income tax. They're under a lot of pressure, and that's gonna play its role. And then also the government needing to continue to fight for foreign investment to be able to bring money into the country in order to create and generate tax from business. So they've got a tough job on their hands. But one thing that has come out of our research, and it comes out of our research year after year, is South Africans are not only very resilient, but also very optimistic. And in all the surveys that we've seen, really with the NID surveys going back over 10 years, the majority, even those in very difficult situations, when asked, do you think your circumstances are going to be improve in the next 2 years, improve in the next 5 years, the overwhelming majority say yes. So there's an optimism that we have that hopefully can help continue to help us fight to see a new day.
Indeed. James, lovely chatting to you. Thank you so much for your time.
Thanks, Mpiwe.
That is Dr. James Lappeman, the head of project at the UCT Liberty Institute of Strategic Marketing, joining us live via Zoom.